So today I want to talk about bone-on-bone arthritis. I get questions and calls to my clinic here in Tampa, Florida every single day of patients that are dealing with bone-on-bone arthritis in their knees or their hip, and they're experiencing debilitating pain, pain going up or downstairs or getting out of a chair. And they really want more options than just the steroid injections or having to have a total knee replacement. So today we're going to talk about the natural regenerative medicine options for bone-on-bone arthritis. Short answer though is there's quite a lot that can be done even in severe cases of bone-on-bone arthritis, but I want to walk you through what exactly is going on and I'll give you your options. So let's talk about what's actually happening when you have bone-on-bone arthritis. So this would be a knee joint. This is the most common area we see bone-on-bone arthritis is in your knee. So this would be your thigh bone, this would be your shin bone, and this is your knee joint. It opens and closes, and you can see with this motion there's a lot of wear and tear that can happen. So that wear and tear, that arthritis starts to happen on the articular cartilage, which is like the shock absorber here on your thigh bone and on your shin bone. And when that wears down, the periosteum, which is part of our bone, has a lot of nerve endings, and things kind of short circuit and causes a whole lot of pain. And so your regular doctor, the only options they're really going to give you are steroid shots. And there's a limit to those because they're actually toxic to our cartilage and to our joints. So you can only get a couple of those a year. Usually their effects are very short-lived. We've known for about 50 years that they're not the best option, that they're toxic to our joints. So I don't really like them. They might provide you with some short-term relief. But if you're here watching this video, then they probably didn't help you too much. The other option is a whole knee replacement. And most people want to avoid those because it's a big surgery. It's months and months and months or a year of rehab, and you're not guaranteed to have a good result. So what are your other options? Well, there's something called regenerative medicine, and my favorite tool is something called Prolozone. And what it does, Prolozone helps to stimulate your body's natural healing response and stimulate your body's natural growth factors so that we can regrow cartilage in these damaged and degenerated and arthritic joints. So what Prolozone is a combination of prolotherapy, meaning proliferative or stimulating growth, new growth of cartilage especially, and then ozone, which is an oxygen-ozone gas mixture and helps to act as a strong anti-inflammatory. It stimulates growth factors and it puts oxygen right into damaged tissues. So it's a great option for arthritic joints. It's a great option for bone-on-bone arthritis. I've helped hundreds of patients with Prolozone injections into their knees to get significant relief both in their pain and restoring mobility and range of motion and function and being able to get their life back. So there are quite a few options when it comes to bone-on-bone arthritis. I love Prolozone. I find that in my clinic, most patients need 3 to 6 Prolozone injections to provide some significant relief and decrease in their pain and restore their range of motion. And then depending on how bad their arthritis is, they might need a booster once a year. But it's a great tool. It's really effective. It's been used for a long, long time, and it helps to actually heal what's going on and causing all your pain. So it's not just putting a Band-Aid on your arthritis or on that bone-on-bone. It's actually helping to heal and regenerate and regrow those damaged joints. So it's a better option than those steroid injections. So if you're experiencing bone-on-bone, or if you have any friends that have bone-on-bone, especially in their knees, it responds really well to Prolozone injections. I have a clinic here in Tampa, Florida. I've treated hundreds and hundreds of these cases with excellent results. So now you know you have more options than just steroid injections or just a total knee replacement.